The procedure for ACL-PCL reconstruction using the conventional femoral tunnel drilling technique begins with a Beath pin being inserted into the femur through an anteromedial portal, from the medial to the lateral direction. This is done using a femoral aimer. Following this, it is over-drilled using a 4.5 mm or 4.7 mm endoscopic cannulated reamer. Then after the tunnel length is checked using a depth gauge to ensure the tunnel is of sufficient size to manage the graft. After this, the tunnel is further enlarged with a femoral reamer and the graft is then inserted. But what if the tunnel length is shorter than expected? The traditional depth gauge for ACL-PCL reconstruction has some disadvantages, such as that it can only measure the femoral tunnel length after drilling with a 4.5 mm or 4.7 mm diameter tunnel. Additionally, if the femoral tunnel length is shorter than expected, it may increase the risk of tunnel blowouts, resulting in weak fixation of the ligament graft. To overcome this challenge during femoral drilling, OsteoCare provides a perfect solution. Introducing Retro Gauge for ACL-PCL reconstruction. Retro Gauge is a revolutionary device for ACL-PCL reconstruction that simplifies femoral drilling for surgeons. It comes with a calibrated Beath pin that is compatible with a depth measuring device. The technique is to advance the Beath pin into the femur using a femoral aimer until the laser line on the pin touches the femur bone inside the joint. A small lateral incision is then made on the skin and a retro gauge is passed over the Beath pin until the distal end touches the lateral cortex of the femur. Where the Beath pin ends, it shows the total length of the femoral tunnel. If the tunnel length is shorter than desired, we can reposition the Beath pin to achieve the desired length. Retro gauge offers many advantages over a traditional depth gauge. It delivers an accurate measurement of the tunnel without drilling a 4.5 mm or 4.7 mm diameter tunnel. It also allows for correction to tunnel position with minimal bone loss when a shorter tunnel occurs. Plus, retro gauge helps make the graft preparation and implant selection process smoother and more efficient.